Do you know if there's any link? I'm interested in neurodiversity in adults.
Yes.
It's something that I haven't seen in the years when I first started in my practice. We didn't speak about it.
No.
Or there was the odd person who was Asperger's
Yes.
or autistic,
Yes.
but they were almost over there.
Right.
It wasn't what we see now, like the Elon Musks and the entrepreneurs and the young people who come to me and who talk about definitely neurodiverse.
Yes.
And this young student will come to me in her pajamas. She cannot wear clothes that have a texture.
Yes.
Like also the attention deficit people sometimes have a sensory
integration problem. Yes. Sensory modulation. Yes.
And a lot with the neurodiverse, with strong visuals, strong sensory sensitivity.
Yes.
But is there an overlap?
Oh, yes.
Please tell me.
Okay. I mean, just first of all, the interesting part is that, as you say, 20, 30 years ago, we were seeing hardly any adults with neurodiversity.
Sure.
And then I started picking up more and more of my patients had quite a lot of features of Asperger's, Autistic Spectrum Disorder.
Right.
Mainly the kind of social unawareness of others. And you picked it up as one got to know them, and that they really had a great deal of difficulty reading social cues, understanding other people's emotions, being able to put themselves in the place of other people. So,
is that like empathy?
Yes.
Is this, when you talked about a person with attention deficit or hyperactivity disorder in social situations without a filter, is this different?
It's different. Okay. It's a different kind of social handicap, really.
Social insensitivity.
Yes, social insensitivity. It's more the impulsive overriding it, and then afterwards, quite often, they realize, that's upsetting somebody, or shouldn't have said that. Whereas the person with autistic spectrum features would be totally unaware of it.
And if somebody said to them, you put your foot in your mouth there, they would be very unhappy and very upset and not aware.
No, they'd be not aware, and they'd say, okay. But it quite often doesn't bother them too much, which is the interesting thing.
Okay.
If it bothered them, they would make the effort to try and improve it.
Yes.
As they get older, quite often it starts bothering them more.
Okay.
So into later or middle adulthood, quite often these people with neurodiversity start trying to work hard because they've experienced social rejection so much, and they're starting to get an idea of what it is, what their difficulties are.
Is it also in the workplace that it shows up quite a lot in teams?
In teams, yes.
That's
not good team players. But what they often are good at is that hyper-focusing part, of being extremely interested and over-involved in their areas of interest. So they will go on and on about their, whatever it might be, their hobby. The kids, it's often about, sort of airplanes. And adults, often about, they quite often get into computer programming, coding, because they are totally engrossed in the details of that.
That's the super focus.
Yes, the over-focusing. It's called, in lay terms, called obsessions, but they're not really obsessions in the sense that we use them psychiatrically.
It's not like OCD.
No, it's not like OCD.
Compulsive disorder.
It's over-focusing, over-interest, and over-involvement in that.
So what do you...
But they very often will have, or may well have, attention deficit disorder as well.
As well as a comorbidity.
As a comorbidity, yes.
What have you seen in your years of practicing with what they call on the spectrum.
Yes, I mean, look, I've seen quite a few patients with it.
Yes.
And you see, the first thing to really kind of negotiate with them is that there's no treatment for neurodiversity.
Good.
Per se.
Comment. There's no medicine.
There's no medicine.
Like there is for attention deficit.
Yes. The neurodiversity, the main form of treatment is understanding what it is and how it affects you, and for those around them to understand. And for instance, in a team, if they've got to work in a team, using their strengths but not expecting them to do things that they cannot do. And not to then put them down or demean them because they can't do those things. They can't read or understand what the other team members are feeling.
I believe that there's a whole centre opened up. I think it's at Cape Town University.
Oh, is there?
The Neurodiversity Centre.
Yes.
And one in the northern suburbs.
Okay.
Because there's my client who's diagnosed herself as neurodiverse.
Yes.
She told me about it, and she said that she told the people in her class,
yes,
they're doing gaming, they're learning how to do gaming, and this is perfect.
Yes.
And she says,
typical.
We all neurodiverse, and we smile about it.
Yes.
And we all struggling to get an appointment at the Neurodiverse Centre.
Okay.
Because I think they're guided. I wonder if they're coached.
Well, I think so.
Well.
Yes, and possibly they're also screened for comorbidity, for ADD, ADHD, for anxiety and depression. And I think sometimes that is secondary to being different and having to fit into a non-neurodiverse world. The other thing that you mentioned is the sensory modulation problems. So they can get help with that. Occupational therapists are now treating adults with that.
Oh, really? That's interesting.
Yes. And that helps them quite a lot, because I had one patient who was extremely neurodiverse, and she was a highly competent computer programmer and sort of did quite high-powered work in terms of programs, but had to fly around the country from time to time. And when she was standing in the queue at the airport, she would suddenly panic. And she would turn to the person next to her and say, just hug me, hold me as tight as you can.
Wow. Which
they did until she calmed down.
So the actual stimulation of her senses, of skin touch.
Yes, that deep pressure helped her.
Wow.
Because it was a sensory overload for her. That really
is
the first line of treatment, is that community acceptance and understanding. And just accept them for how they are. Yeah.
And some level of brilliance.
Yes, very often. Look, not all, but certainly there are many of them who do have.
So that's what one might see is islands of brilliance.
Yes.
And then there would be others, I presume, across the intellectual spectrum.
Absolutely, yeah.
Who don't
have that island, those islands of brilliance,
which makes it
more difficult for them.
Yes, yes. Are some people who are diagnosed with an extreme form of neurodiversity hospitalized, institutionalized?
Yeah.
And is there a level of psychosis that goes?
Yes, they are more prone to psychotic illness.
Okay.
And it depends on the intellectual level. Those who are intellectually handicapped very often do have to be hospitalized.
I wondered.
Yeah. And it's in them that it seems there's a much higher level of psychotic breakdowns at some stage.
So then that would be treated?
Yes, that would be treated with antipsychotic medication. Yeah. Quite a lot of those patients do have kind of paranoid symptoms, but it's not really paranoid psychosis. It's what I call paranoid anxiety.
Watching that somebody...
And they develop the feeling that the world is against them because everybody picks on them
Yeah.
And I'm always wrong. Nobody likes me and nobody helps me and I can never get, that sort of attitude.
Like quite a negativity.
Very negative, but it's not a negative in a depressed way. No. It's negative in a persecutory way. They feel that the world is picking on them. Generally speaking, I look at treatment not as treating a disorder or condition, but as treating symptoms.
Okay.
So in some of these people, have this paranoid anxiety.
Right.
And I find a low dose of an antipsychotic medication is a very effective anti-anxiety medication for them.
So this you would have learned through your experience.
Through experience, trial and error, yes.
Does a person with a neurodiversity, with a sensory overload, I don't know what you call it.
Yes.
Do they often have body aches and pains, sensitivity, like arthritic body aches and pains? Or
yes, look, they may have. I mean, it's not something
not necessarily
that they've complained about to me that I've heard. But it may well be that there's altered processing of stimuli. And pain stimuli might be one of them, because we know that particularly in chronic pain, that most of what happens there is within the central nervous system, not the peripheral nerves. It's the sort of gateway mechanisms of the nervous system and so on. And the perception of pain, that's so important. But that's an area that I'm not experienced of in terms of actual clinical practice.
Do you find, or have you found, that people who have this disorder, condition of neurodiversity, tend to have relationships, get married, have children?
Yes. No, they struggle with relationships generally,
I should imagine a longing for?
Yes, quite often they do long for at some level. Also, it's said that they don't have empathy, but I don't think that's quite true. I think they can have some empathy for other people, but it's kind of different. It's often an unawareness, but if they become aware of the other person's feeling, they can feel quite upset or quite attached or whatever.
And is it in your experience often, I don't want to call it narcissistic, but an involvement with self?
Yes. It's self-centered, but not in so much. Narcissus looked in the lake and he saw his reflection. He thought, "This is one beautiful person."
Not so.
They don't do that.
No.
But they kind of cut off from others, so they are quite self-centered.
Self-centered rather than narcissistic.
Yes.
Okay.
Yes, very much so. Often.
So, adult people with neurodiversity, you would find this out, or you'd recognize this in their behavior, in the way they describe their lives at work, at home.
Yes.
And you'd go along the route of helping the person to understand that this could be a problem.
Yes.
And then offering perhaps the system.
Right.
Ways in which to acknowledge, have insight into. You almost do an education.
It is, and that is what the main line of treatment is: psychoeducation of the individual and of those who live closely with them. Yes. Often it would be quite beneficial to give some psychoeducation to their employers or the teams they work with. But that's kind of ethically quite difficult to do. I didn't ever actually get around to doing that. But certainly with family members, definitely to educate them, say, this is how this person is. They're not being difficult, but this is how they are, and this is what you can expect. And very often the family and the patient, the index patient, found that very helpful.
Yes.
Yeah.
Thank you. You've added to the pocket of information and education And what I'm hoping is that with your experience and with our talking and our conversation, if we touch 1 or hopefully 10,
yes,
or 10,000,
yes,
or 100,000 people who recognize something in themselves in what we've spoken about,
right,
I will be very grateful.
Yes, hopefully, I hope that this has been helpful. Yes.
Thank you. Thanks very much, Carl.
Yes.